All right, let's jump right in. There's a quiet but pretty powerful revolution happening in healthcare right now. It's shifting our whole focus away from the pharmacy counter and toward the park path. We're going to explore a new kind of prescription today, one that could totally change how we think about medicine.
This place saved my life. I mean, just let that sink in for a second. Those are the words of Wendy Turner. After losing pretty much everything, her job, her business, her home, she ended up in an emergency room. But her recovery? It didn't come from a pill bottle. It came from a place. So what was it? It was a nature reserve.
You know, a story like Wendy's really forces you to ask a pretty big question. What if the best medicine isn't something we swallow, but somewhere we go? What if the most powerful healing tool we have is already all around us, just, waiting to be prescribed?
To really get why this idea is gaining so much steam, we first have to look at the problem it's trying to solve, and it's a uniquely modern one.
Look, our healthcare systems are under a ton of pressure. We're living these increasingly indoor, screen-focused lives, and the results are pretty clear. Stress and anxiety rates are skyrocketing, along with chronic stuff like high blood pressure. Now, traditional medicine is absolutely essential, but it's becoming obvious that it can't handle all of this alone.
So, what's the solution here? Well, this is where this really innovative idea comes in. It's called Nature on Prescription, or as you'll also hear it, green social prescribing.
I want you to just imagine this for a second. You go to your doctor, you're feeling stressed, totally run down, and you walk out not with a slip for the pharmacy, but with an actual recommendation to go visit a local park for a couple hours every week. That's the core idea. It's so simple, but it's also kind of profound.
And here's the crucial part. This isn't just some friendly, off-the-cuff advice like, hey, you should get outside more. Nope. A green social prescription is a formal, structured recommendation from a healthcare professional for things like walking, gardening, even conservation work, all specifically aimed at making you healthier.
What's really fascinating here is that green prescribing is actually part of a much bigger movement called social prescribing. That's all about connecting patients to non-medical support in the community. So green prescribing just zooms in on one super powerful tool in that big toolbox, nature itself.
So why does this work? Is this just a nice, fluffy idea, or is there some real science behind it? Well, let's take a look at how nature actually heals us.
Oh yeah, the evidence is overwhelming. Seriously, study after study shows that being in nature has these huge effects on our minds and our bodies. It actually lowers your stress hormones, which helps lower your blood pressure. It can even boost your immune system. And for your brain, it lets the part of your brain that's always buzzing with thoughts just rest. That helps you focus and be more creative. This isn't just a feeling. This is your actual physiology changing.
And listen, this isn't some fringe concept. We're talking about healthcare systems all over the world taking this seriously and making it part of their mainstream practice. It's a credible, global movement.
You could say it all started in Japan. They have been pioneers for decades. They call it Shinrin-yoku, or forest bathing. And get this, it's been part of their national public health program since way back in 1982. They've poured millions into researching it.
And then you've got Canada. They've taken this a step further. Their ParkRx program is this amazing national initiative where a doctor can literally prescribe you a free pass to one of the country's national parks. How cool is that? It just removes that barrier to getting out there.
Here in the United States, it's really taking off. ParkRx America is now active in 35 states. 35! They have a whole platform where doctors can look up a database of thousands of parks and prescribe a specific one that's close to their patient.
And over in the United Kingdom, you're seeing huge institutional buy-in. The National Health Service, the NHS, is actually funding pilot programs because they see this as a key tool for mental health. When an organization that big gets involved, you know it's the real deal.
Okay, so this is all fantastic on a global scale, but what does it mean for you, for us? Like, how much nature do we actually need? Let's talk about the weekly dose. I want you to remember this number, 120. A huge study in 2019 found that people who spend at least 120 minutes, that's just 2 hours a week, in nature felt way healthier and happier than people who didn't. 2 hours a week. That seems to be the sweet spot for getting real benefits.
And here's the absolute genius of it all. This doesn't require building new hospitals or inventing some complex new technology. It's all about using the incredible health infrastructure we already have, but often don't think about. Our local parks, our trails, all our green spaces. They're these powerful, low-cost health tools just hiding in plain sight.
So, what does this all add up to? I mean, is this what the future of medicine is going to look like? Now, let's be super clear here.
No one is saying this is going to replace traditional medicine. Not at all. It's about adding another powerful tool to the healthcare toolbox, one that helps us get to the root cause of issues and focus more on prevention and keeping people well in a really personalized way.
So that kind of leaves us with one final thought to chew on. As we keep looking for smarter, better ways to improve our health, we have to ask ourselves, could our local parks one day become just as important to our health as our local pharmacies?